Hi everyone, I am going to present about increasing the human resources in the public health sectors and building healthier communities by doing the prevention. To overcome the inequity in the health care, one solution is to increase the human resources to deliver the health care to the public. The migration of healthcare workers is an issue that arises when examining global healthcare systems. The internal movement of the workforce to urban areas is common to all countries. As more health professionals emigrate to urban areas, which can cause the imbalanced distribution of workforce and workload. In addition to salary incentives, use other strategies such as housing, infrastructure and opportunities for job rotation to recruit and retain health professionals, since many health workers in developing countries are underpaid, poorly motivated and very dissatisfied. The migration of health workers is an important human resources issue that must be carefully measured and monitored. An aging population within the healthcare system itself also has important implications. Additional training of younger workers will be required to fill the positions of the large number of healthcare workers that will be retiring. Private physicians is generally not employed by the government, but rather is self-employed and works in a private practice, and their numbers is higher than public physicians, so make a policy that they can deliver publicly funded care to citizens. Physicians will negotiate fee schedules for their services with their provincial governments and then submit their claims to receive their reimbursement. For every issue regarding the health, prevention is the main concern. A focus on prevention will not only improve the health, but also help to reduce healthcare costs, reduce ourselves on relying on the treatment, and can improve quality of life. Prevention can be considered on a number of levels. Primordial prevention seeks to prevent at a very early stage, often before the risk factor is present in the particular context, the activities which encourage the emergence of lifestyles, behaviors and exposure patterns that contribute to increased risk of disease. For example, a child seeing their parents smoke cigarettes may wrongly consider this a good lifestyle choice for later in life. Advising parents to quit smoking in such circumstances can be considered primordial prevention. Primary prevention, prevention of disease through the control of exposure to risk factors. Strategies for primary prevention include population-wide strategies and targeted, high-risk strategies focusing on population subgroups. For example, careful weight control prevents obesity, which in itself is a risk factor for many conditions including heart disease and diabetes. Secondary prevention, the application of available measures to detect early departures from health and to introduce appropriate treatment and interventions. Screening is a major component of secondary prevention. For example, cervical screening for women to detect early changes which may go on to lead to cancer of the cervix. Tertiary prevention, the application of measures to reduce or eliminate long-term impairments and disabilities, minimizing suffering caused by existing departures from good health and to promote the patient's adjustments to his/her condition. For example, a person identified as having type 2 diabetes will have regular blood glucose checks to monitor control of their diabetes and prevent complications of the disease. Strategies for prevention. Support rapid communication and coordination between public health practitioners and clinicians to increase use of evidence-based prevention strategies to address risk factors for disease and health conditions. Detect the disease early, manage conditions before they become severe by increasing the appropriate use of screening and prevention services. Ensure quality delivery of recommended clinical preventive services through the entire continuum from preventive service through diagnostic follow-up and treatment. Increase the use of preventive services by promoting their availability, monitoring their uptake, and utilizing related improvement programs. Increase access to primary care and preventive services, particularly among vulnerable populations. Disseminate best practices for use of substance abuse screening and intervention in acute health care settings, including screening for excessive alcohol use and brief intervention. Rising healthcare costs are large part due to our chronic disease epidemic. Prevention is health promotion. Point in life represents an opportunity to reduce risk by adopting healthier habits. Eating a healthy diet, Engaging in regular physical activity, avoiding tobacco use and excessive alcohol intake, and adhering to medications go a long way toward delaying the onset, reducing the severity, and preventing the development of NCDs. Preventive care at every stage of life helps to stay healthy, avoid or delay the onset of disease, keep diseases they already have from becoming worse or debilitating, lead productive lives, and reduce cost. These are the references for the presentation.